Welcome to the very first episode of the Expert Voices by Infollion, where we bring together experienced industry leaders to discuss on current trends, challenges, and the future of their industries. Today, we are delighted to host Mr. Neeraj Lal, a highly experienced healthcare leader with over 25 years of experience in healthcare management, hospital operations, strategy, quality, and leadership. He is currently associated with Medicover Hospitals as the regional director, and he has previously worked as the chief operating officer at Apollo Hospitals as well. He has been associated with Infollion for almost 11 years now, and it's an absolute pleasure to have you with us today, sir.
Thank you very much, Shruti. Thanks very much.
Yeah. So, Mr. Neeraj, we would love to know some views from your lens. So, healthcare excellence is, often measured through clinical outcomes. But from your experience, we would like to know what truly defines excellence in healthcare beyond just clinical success.
All right. See, I believe clinical outcome is just the entry gate to the hospital, right? Patient come because the clinical outcomes are great. But real excellence is what happens around that outcomes.
Right.
In order to experience those outcomes, what is happening around that? I look at five things. You know, patient experience that feel human.
Right.
Say, for example, no fancy lobbies, just
Right.
clear communication,
Right.
dignity, less waiting times, the most
Hmm.
important part. No confusion in the
Hmm.
billing. Generally, after surgery, the most important thing is billing. So we
Billing.
have billing counselors, so no confusion in billing. A
Right.
patient who understands their, their care, trust you more. It is all about trust. I think healthcare is more a trust.
Right.
See, while we fly a plane and we are in the plane,
Right.
so they tell, okay, he is your captain, they'll be flying. We don't question there, right?
Right.
But and we don't know how many hours of experience, flying experience they have, right? Whatever name they
Right.
say. But in healthcare, I think it is very, very important whenever a
Right.
patient choice a particular doctor or a hospital,
Right.
okay, he's qualified, his credentials. Somebody will say his first surgery, so he'll
Right.
get panicky. So I think a patient experience that feel human, I feel is one of the important thing. Second
Hmm.
is team culture, like low ego, high accountability. Then you have nurses feel heard. Junior doctor can escalate without fear.
Fear. Yes.
I think culture of the organization directly impact the safety more than the protocol. I think it is culture which is most important. Then consistency. It is not just occasional brilliance. Sometime you are consistent. No, one great surgeon doesn't make a great hospital. I always believe.
Right.
But is our system deliver safe care at 2 a.m.? The care which is given at 2 p.m. is same at 2 a.m. Because at
Hmm.
2 a.m. the staff is skeletal, the
Right.
management people are not there,
Hmm.
senior and consultants are not there.
Hmm.
So on a Sunday, the care has been given same only. With the
Hmm.
junior team on duty, that is excellence. So I think consistency is not an occasional brilliance. Last but not the least, I feel transparency and trust. Being upfront from complication, cost, and limitation. And I think in our country, especially in India, trust is the biggest brand asset. Most of the people value a company or value a hospital when you have a trust. And
Trust.
healthcare is the human excellence, you
Human
know,
excellence.
which is given with that. I think that is, I feel, the excellence in healthcare beyond the clinical outcomes.
Yes, and that's very interesting when you said that trust is everything, when a patient enters any hospital. Yeah. So, hospitals today are, under constant pressure to also maintain high quality care, as you also mentioned. So, while also staying financially sustainable. So, in your
Yes.
opinion, in your lens, how can, healthcare organizations balance both the things effectively?
Okay. I think finances are very important to run the business. I think this is a real game. So if we ignore finances, so quality won't survive. So if you chase margins, whatever we do in the healthcare,
Mm-hmm.
blindly, reputation collapse. So therefore, what actually works? Financial sensibility, standardization. I think these are the days of packages. So I think standardization is one of the most important thing. So I feel standardization is equivalent to cost control plus quality. So while you are standardizing various protocols like clinical pathways, bundled consumables, this reduce variation, like improve outcomes and control cost. Like most
Right.
of the hospital now, what they're doing, they're creating a package or they're creating the kits. They're creating a pharmacy kit. So if you're doing a surgery, it remains same.
Right.
So every surgery or procedure, your pharmacy is not differentiated. Therefore, variation is getting reduced, outcomes are improved, and it improved the cost. One, I feel standardization. Second, I feel right case mix. Not just high volume. These are the days where you have, cash patient in the hospital. You have
Right.
credit, both
Right.
TP as well as low paying scheme. So what I feel, uh, you know, hospital does not require more patient. You require a right patient which you are known for. So complex high value specialties, is subsidized, low margin services, because these are the days when every kind of patient come to you. You cannot say no. You are a scheme
Yes.
patient, your charges are less, to will not. So you have to see all kind of patient. A patient standing in a queue paying 500 rupees for a CGHS, and at the same time
Right.
he's paying 2000 rupees for a doctor consultation. So I
Right.
feel right case mix is very, very important. And so you have to have a complex surgeries, high value specialties which can cross subsidize your low margin services. Third is operational efficiency. I think that is the most important part. With, I think, some of companies like some of the aviation companies has made a difference. How they operate efficiency. So I think in healthcare, OT utilization. You are opening the OT at 8 and closing by 6. No,
Yes.
OT should be, like post surgeries in the morning hours between 6 and 8,
Hmm.
or post surgery something between 6 and 9 in the evening. So I think OT utilization is a key. If your OT is not utilized properly, you don't have a good number of cases and case mix. Second is bed turnover. I think every hospital is talking about bed turnover. So average length of day should be minimum. And thirdly, small improvement, utilization, bed turnover, length of stay translate into huge financial impact without touching clinical quality. So I think if we do these things, that is more important. Fourth thing, doctor alignment is also very critical. Like, say, if clinician and management are not aligned, they cannot run like orderly. They have to be aligned. If they are aligned, I think cost will not be an issue. See, whatever protocols you are made, if your clinicians are not aligned, your pharmacy will go high, your consumption, your margins are very high. So I
Right.
think if the clinician and management are not aligned on cost conscious care, nothing will work. So we need data transparency, not policing. So if we have a data exchange between the management and doctor on a continuous basis without policing them. So I think doctor alignment is critical for the financial part of it. And over capitalization traps, like fancy technique without utilization is a silent killer, what they say. So every investment should answer, will this improve outcome or just perception? So we used to say ROI. And last but not the least, what I feel, strong revenue cycle management, especially in our country where insurance delays are there, and you
Yes.
have documentation gaps, you have package
Yes.
leakages. Sometimes go beyond, if package is for 3 days, it is going 4 days, your pharmacy goes up. So these quietly eat margins. So I
Yes.
think
Absolutely.
you are giving a service to a patient and you're getting money from the credit companies, in 60 days or 90 days. So everything is blocked. So I think we should have a
Yes.
strong revenue cycle management. So what I feel, efficiency is not cutting corner, I believe. According to me, it is removing waste. I think that
Right.
is more important part in order to be financially sustainable.
Absolutely, sir. These insights are really helpful, whatever you shared just now. So, looking ahead, what do you think the future of healthcare leadership in India would look like in the next few years?
So honestly, I feel the next 10 years will demand a very different kind of a leader. not a laptop managers. Like if a hospital manager is a laptop manager, then it will not work. So it is data driven now, not an instinctive driven. Earlier, if you go 5, 8 years back, the people are instinctive. They are taking the
Right.
decision based on their experience and instinct. I
Yes.
think now leaders will need to understand dashboards, uh, the business analytics, the predictive insights means you are doing a
Yes.
health checkup, you are doing, you are doing various things. So you can predict it tomorrow because based on the season, based on the day, your occupancy is high. So accordingly, you can host the people accordingly. So not just rely on experience. So number one, data driven, not instinct driven. Then you have a clinician administrator hybrid. So administrator will be the gap between doctor and management will reduce. The best leader will speak both the language fluently. See, if you feel if the alignment is better, that is more important. Now, digital first thinking. Now, majority of the patient come to the hospital if you are on a digital platform. So telemedicine, AI diagnostics, EMR, remote monitoring. I think leaders who resist technology will become no more into
No
the
more.
healthcare
In.
business.
Yes.
So I think it is a pastime. So I think that is digital first thinking, I believe. How can I digitize the entire process? Because the more and more you digitize, more and more revenue will be, which is going to be leaked and be closed.
Close.
And
Yes.
then network thinking over single hospital mindset. So healthcare is moving from a standalone hospital to a integrated network now.
Network.
So hubs, spokes, home care, and digital era. I always say these days healthcare is moving away from the hospital. Say, for example, we have 100 ICU beds, so we are not supposed to manage only 100 beds. So if we virtually collect various nursing home ICUs to our hospital through a dashboard with AI as well as machine learning, so we have a control over all these beds. So, like say in our hospital, instead of 100 bed, we manage around 5,000 ICU beds. Why? Through this focus. So we are available as a hospital. We are also available as a primary health centers. We are also available at home health care, and our almost 90% of the admissions it is coming through a digital route. Our lead generations, our OPD consultation, and all. And stronger focus will be on affordability and scale. I think leaders must deliver quality at scale, not a boutique experience. And
Right.
people leadership will be matter more than ever. People management and people leadership. So burnout is real, and retention of
Yes.
nurses, technician, junior doctor will be a major challenge because
Major challenge.
healthcare run by these three pillars: nurses, technician, and junior doctor. These three pillars are very important. Doctor cannot work if these three
Right.
people are not there. So I
Right.
think leadership will matter more, and the regulation and transparency will increase. More and more regulation, pricing scrutiny, quality benchmark like NABL, JCI, Quality and Accreditation Institute, like various single specialties like stroke accreditation, fertility accreditation. So leaders need to be a compliant smart, not reactive.
Reactor.
So
Yes.
what I feel the future of Indian healthcare is a part operator, a part strategist, part technologist, and deeply people centric. So these four things as important. He is operator, he is a strategist, he is a technologist, and people centric.
Right. Right. And the upcoming generation also is like everything is based out of trust these days. So as you said, the technicians, the junior doctors, and the nurses, they are the pillar for a doctor to handle everything smoothly.
Yes, true.
Yes.
Then only the patient care is not hampered. So I feel what treatment you are doing at 2 a.m., your similar treatment you're giving at 2 p.m. So 2 a.m., you don't have doctors, you don't have entire hospital machinery, you have medical officer, you have nurses, you have
Right.
technicians. So
Right.
therefore, I think alignment with these people, with the hospital protocols, I think it will make a difference.
Right. Right. So that's it from my end, sir. Thank you so much for taking out the time to share your valuable insights. And it was truly wonderful having you on our very first episode of the Expert Voices by Infolian.
Thank you.
Thank you so much.
I think I have done a justification to your talk.
Yes, you did. And absolutely for the audience too.
Yes, yes. Thank you very
Yeah,
much.
thank you very much, sir. Thank you so much.
Thank you.